Conversations for Health, dedicated to engaging discussions with industry experts, exploring evidence-based cutting-edge research and practical tips. Our mission is to empower you with knowledge, debunk myths, and provide you with clinical insights. This podcast is provided as an educational resource for healthcare practitioners only. This podcast represents the views and opinions of the host and their guests and does not represent the views or opinions of Designs for Health, Inc. This podcast does not constitute medical advice. The statements contained in this podcast have not been evaluated by the Food and Drug Administration. Any products mentioned are not intended to diagnose, treat, cure, or prevent any disease. Now, let's embark on a journey towards optimal well-being, one conversation at a time. Here's your host, Evelyn Lambrecht.
Welcome to Conversations for Health. I'm your host, Evelyn Lambrecht, and I'm here with nurse practitioner Lexi Yoo, founder of Yoo Direct Health. Welcome, Lexi.
Yeah, I'm so excited to be here. I love this podcast. I love so many of the topics that you cover. And so I'm super honored and excited to get to share some of the things that I'm passionate about with you guys.
Thank you. And thank you for being a listener. That's awesome. Lexi is the founder and owner of Yoo Direct Health in Indiana, where she focuses on integrative medicine, anti-aging treatments, and bioidentical hormone replacement therapy. She's a double board certified nurse practitioner in the areas of family and pediatric medicine with a passion for providing comprehensive and personalized care to her patients. She's also an Institute for Functional Medicine certified practitioner and completed an aesthetic fellowship through the American Academy of Antiaging. Her expertise in this area makes her a sought-after national speaker and trainer, sharing her knowledge with other practitioners. She's a trainer for Galderma Aesthetics, and beyond her clinical practice, Lexi is committed to research and education. In 2022, she developed an Integrative Residency Program, and then in 2023, the Yoo Direct Health Training, a virtual platform that brings like-minded practitioners together for advanced training. She also has a podcast called A Better You Project, where she explores the synergy between integrative medicine and aesthetics. That is awesome. So Lexi, thank you so much for being here. First of all, what is lighting you up this week?
Yeah, let's see here. We've started doing some really cool therapies to help our patients with balancing out sympathetic and parasympathetic. It's a new treatment modality to our practice. It's not new in medicine. It's called neurotherapy. And so I've had some really cool cases this week, especially. So I live in Indiana and we had a time change this week. And so it's getting darker earlier. And just some different cases. I had a case of some PTSD that's getting better. So it's really exciting just to kind of see how we can offer some integrative therapies to our patients that they would not have access to and actually seeing other therapies work better with it.
That's awesome. If we have time at the end, I'd love to go back and talk more about that.
Oh, for sure. Yeah.
Awesome. So I actually would love to dive into the business aspect first. So you became an NP in 2011, right?
Yep. Started then.
That's awesome. So I know that you've grown a lot in the past few years, and I'd love to just hear more about what that journey has been like for you. Like when you graduated from as an NP, was it your vision to have a brick and mortar practice or multiple and to do online training, or is it something that gradually developed? Just share that journey with us.
Yeah, absolutely. It's a really weird journey. I never thought I'd end up where I was even just 5-6 years ago when I opened up my own practice. So I started out in pediatrics and I worked in the most acute care setting you can work in. I work in peds general surgery and trauma, right?
Wow.
So wellness and all the stuff that I do was not even on the radar. It was, saving babies from all kinds of different things and surgical patients. And so I've always loved pediatrics and a passion for children. But ultimately, as I grew up, as a mom, and it got really difficult taking care of sick kids when, it's hard to not see your kid when they're that age, right? So I decided to leave the acute care setting and I went to go work at a big hospital system like many nurse practitioners do. And I started out as like in a pediatric urgent care, which I'm also Spanish speaking. And so it was great because I was able to help a lot of the pediatric population who had a language barrier. The network that I was working for, they approached me. They're like, we love you. We think you're great. We would love for you to start seeing adults. I'm like, well, it's not really what I'm trained in. And they're like, we'll send you back. We'll pay for everything with which is like nowadays, I'm like, that's unheard of. So I seized the opportunity and I love to learn. So I'm like, I can do this. Right. So I got postmasters in family practice and I worked for them for a really long time, which was great. I'm still raising my kids, but at the time I had, toddler twins and they're 15 now. So,
Oh, wow.
So it's been quite some time. And then I had started CrossFit, which really kind of started digging my way into wellness and that, they really push like clean eating, paleo zone, just really being more mindful of those things. And so I don't know if you know any CrossFitters, but once you drink the CrossFit Kool-Aid, you're like hooked, right? So there was an opportunity to go work with a bariatric practice. And I was like, oh, this might be kind of cool. So when I started working with this bariatric practice, I got to learn a lot about nutrition and not necessarily gut health has like how we talk about like, oh, a 5-hour protocol. Look at it, not like that, but like how your gut absorbs nutrients and how that can affect hair loss and skin integrity and nails and all these other things. And so my counterpart was a dietitian. So I really got into some of the nutrients and supplements and things like that, which, I always kind of keep learning more and really looking at food as medicine. Then there was an opportunity to go work with a DO, a doctor of osteopath, and he was a cash pay only practice. And he was looking for a provider to help them kind of build out a wellness weight loss program. And that's actually when I started doing the IFM. So I started my functional medicine training because, people are like, well, is there a degree that you can get? Not really when you're a nurse practitioner. You can become a naturopathic, physician. So I had started the IFM program at that point. And so that was about 2016, 2017. And then, some things changed and, I kind of wanted to do things my way. And so in 2018 is when I decided, I can't go back to a big network, but I kind of like what I'm doing, but I think I need to do it on my own. So in Indiana, we do have to have a collaborative physician. So I have a wonderful collaborative physician who he's a DO. So he's open to a lot of the concepts that I talk about. And I meet with him a couple times a month. We talk very often. And so he oversees our practice. But ultimately, so we started in 2018. I was a single practice provider and it's like 6 years, like next month. And so I have 5 nurse practitioners, 2 location, 5 registered nurses, medical assistant, 24 employees, a training academy, all kinds of podcasts, all kinds of things. So I love to learn. Ultimately, I love to teach. Why the academy started was because as I grew in the Midwest, I'm a nurse practitioner, and I think it's almost like other nurse practitioners start watching you, and they're like, I want to do that. I want to do that. So it was always this: can I pick your brain, or how do you do this, or how do you do that? And it's just like it's hard because you do want to help build up the profession, but at the same time, you're like, I'm trying to work on my own stuff. And so I started doing these classes and right around the pandemic, Zoom was such a boom. And so I was able to figure out like how to record it. And I'm a really impatient person. I don't know if you can tell that. I'm a real impatient person. I'm like, I'll figure it out myself. Like, I don't need anybody's help. I will figure it out. So I launched my own podcast. I was the editor, the writer, all the things I, distributed, I figured out how to do all it, recorded it. Same with my academy. I figured out how to record it and do all those things and launched it. And so now I have a bigger, robust team to help me deal with it because you can't do everything. So that's kind of how I got to where I am. And then I started speaking. I started getting asked to speak locally, and, that grew. And I just kind of nationally, I do a lot of work with this company. It's an educational platform called New BioAge, and they're focused on a longevity certification. So we really focus on health span. So I'm one of their, kind of lecturers in their capacity. I teach for BioTE, which is a hormone training company. I've been asked to speak at lots of different topics in the world of longevity. So I'm very, very fortunate. I love what I do. I still see patients. I do my podcast. I still teach. I have shadows all the time. So I love it. I'm very blessed to do all the things I can do.
That's amazing, Lexi. I hope you sometimes stop to take it all in and acknowledge all of this.
Yeah. Yeah.
So what would you say are maybe like 1 to 2 of the biggest things you've learned through this process, especially in the last few years that you've had your two practices and grew with so many employees. And then maybe your biggest advice to practitioners who want to grow in the same way?
Yeah, I think the hardest part is finding the right people, right? So we started in a 1,500 square foot space, and 2 years ago, I built a building. Like I own the building that my practice is in, and it's 10,000 square feet.
Wow.
So we went from 1,500 to 10,000, right? So I have this like vision to change healthcare, and so sometimes that can scare people, and sometimes people are like, "Yeah, let's do that," right? And so my first advice would be, there's no perfect, hiring process to find those people. It's kind of like dating, right? Like you got to go through a couple days to figure out what you like, kind of thing. So I think, sometimes parting ways with employees who just are not a good fit in certain ways, and that's completely okay. As you kind of grow up in your business, your culture is going to change a little bit, and kind of where your vision is going to change, and that's okay. And you're going to find your employees who are going to evolve with you, and that's awesome. And you're going to have employees where they were good for kind of like phase 1, but now we're on phase 3. And so that can be kind of scary for them. And so it's fine to part ways. So I think that's a big thing is honestly, I mentor other practitioners. Hiring and training is probably the hardest part with that. I would say that's one piece of advice is the people part. I would say the second piece of advice is that if you keep your intentions pure, the success will follow. And I can't say that and stress that enough. Is a lot of times when I get shadows from physicians or NPs or PAs, and they're like, I have a lot of business questions, which it's important to know the business part of it. But I think if you keep your intentions pure and don't lose sight of why you started this, all the other amazing stuff, it just happens. Like it kind of just happens because people trust you and people believe in you, and people are, they're gonna try out this crazy new idea that you had because you haven't steered them wrong yet. So I can't stress that. And be like show them who you are. Like I love that social media has allowed such a free platform to kind of, it can be good and it's bad, but open my life to people. I love it when people come shadow and you talk to my other nurse practitioners like, oh my God, I feel like I know you guys, because they see you let them in, which I think gives a very human aspect to it. And people want to do business with people, not organizations. So I think keeping your intentions pure and don't lose sight of that.
I love that. Those are great pieces of advice. Thank you. And you mentioned you've sort of narrowed in on focusing on longevity. And so I'm curious what that means to you. And I'm also curious, how do you quote unquote like sell longevity? Like, are you marketing that? Or is it that patients see you on social media and they're like, hey, I want to do this longevity program? Or that's a term that you're using for all of the other things that people are coming in for?
I think now is a good time to kind of, when I say longevity, it's encompassing, instead of, it's one thing to live a long period of time. And, we call that lifespan. And I know Dr. Attia stresses this a lot, but it's more about improving health span.
Yep.
Right. So it's how do we live a long time, but like have our mind with us still, like it's one thing to live long, but then if you have Alzheimer's disease or dementia, it's like, what's the quality of life there? So what I do is it's not one thing. They're like pillars, right? So I don't want to say it's like a pyramid, because then it implies that something is more important than the next. And that's not really how I look at things. And so I always say I have foundational stuff, right? Which are hormones and thyroid, gut health, right? Which if you start focusing on those little things, then you kind of get to the next layer of it. But ultimately it's all important. So really what I don't want to say sell to the patient, but what I try to make them understand is you and we're on the same team here. And I want to know, and I always say, and I tell patients this, I know this sounds so cheesy, but in your own words, I need to know what your top 3 goals are in order of most importance to you. Because if they tell me I'm constipated and, I poop once a week, in my mind, I'm like, okay, gut health. But if they tell me 3 other things, I'm like, okay, even though that's my priority, that's not theirs. So I need to help them get to some of their goals, right? But ultimately, if you're finding root cause, like you're going to get there anyway.
Right.
So it's about meeting the patient where they're at and really helping them understand you are in charge and I'm here. I'm just the tool that's going to help you navigate. How are we going to get to those goals? And then once we're there, how do we become more proactive with preventing things from escalating, whether it's your family history. And we always say genetics loads the gun, but lifestyle pulls the trigger. So how can I help you optimize your health so we don't turn on those genes, or we're reducing the risk of those genes? So we do a very robust longevity panel where I look at LP little a, ox LDL, small dense LDL, ApoE, a full kind of battery of tests. That's not where I start. That's where I move to. But that's so people can really understand where are they on this continuum of health, and where should we really allocate our first level 1 actions, because I think it can be so overwhelming, right?
Absolutely. Since you mentioned the longevity panel, you just listed a few advanced cardiovascular markers. What are some of the other key markers that you consider as part of that panel?
Yeah. So I'll look at homocysteine. I'll look at IGF-1, and especially because we do a lot of peptides in our practice, I want to make sure it's like Goldilocks, right? Like I need good IGF-1, but I don't want to be too high. I look at GGT, which is, measures your total toxin burden kind of thing. I look at all their hormones, all their thyroid markers to include, reverse and TPO antibodies, uric acid. Let's see here on the panel that we do. We also look at a cholesterol balance sheet. So we look at, are you an overproducer? Are you an overabsorber? Are you neither? Are you both? Alpha lipoic acid, ox LDL, ApoB, that's on there, LDL. So if you look at really, biomarkers of longevity, it's all on there and then some kind of thing.
Okay, so can you walk me through, say I'm a new patient who comes to see you, say I'm in my 40s, starting to have perimenopausal symptoms, for example. Can you describe what that journey looks like in your practice?
Yeah, absolutely. So when we set patients up for an appointment, we have our front office kind of do some of the businessy stuff. So this way they know that we're already like on the same sheet of music and that we're a good fit. So we're a cash pay only practice. We don't take insurance for care. They can use an HSA, and our staff tells them that. And so we do an intake, and there's certain things that we are very clear that we do not manage. And our staff will say, like, if you're pregnant, we actually prefer you to come and, see us when you're done with the pregnancy kind of thing. Active cancer, we don't manage anything with that. Just because there are certain things that's not my specialty, and I'm really good at what I'm good at. And we kind of defer that out, and that's fine. And that's totally fine. So they'll schedule their first 2 appointments. When they come to the office, we set them up with our EMR system. So we use a really great functional medicine EMR system called CERVO. And in that, they will get an intake ahead of time. So I always, when I'm training practitioners, I'm like, this is like the 30-second trailer of what you're about to walk into, right? So in there, we actually have a symptom questionnaire. So I have an idea, like, are they having hot flashes or they're not having hot flashes? Let's say they've had like a partial hysterectomy. Okay. So I know they have ovaries, but they don't have a uterus. So looking at an FSH level is going to be really important, right? Let's say the intake says they have PCOS. So then in my mind, as I'm prepping for this, I know I want to check luteinizing hormone. I want to look at an FSH, an insulin, and an A1C. So they do an online kind of questionnaire. They come in for their first appointment. So we use a body composition analysis for all of our patients. It's like a vital sign, like in our practice, and we use the InBody. And so the InBody helps us look at body composition. And the reason why we do that is because when we optimize hormones, a lot of times we're going to see some great impact changes on reduction in visceral fat and improve in lean body mass. But as we add in peptides, i.e. some of the GLP-1s, I want to make sure that they're not losing muscle. I want to make sure they're losing the right kind of weight. Let's say I add in some other peptides that target visceral adipose tissue, like a peptide called tesamorelin. I want to make sure that they're losing a visceral adipose tissue. So it helps me gauge where we're at. Plus, patients love data on themselves. So they come, get an InBody. Our support staff do their intake, and then I go in and I ask all kinds of questions, right? So if you think about, like, in functional medicine, we talk about the matrix. It's not that in depth. We kind of start at like, all right, let's talk about like the last 10, 20 years kind of thing, not at birth, unless it's pertinent. And then we have a lab in-house that we've contracted to come in. So we house them in my building, but they are part of their own entity. And so the patient can get labs right here in-house.
That's amazing.
we always schedule their it's super convenient. Yep. And they can do Boston, they can do Genova. We carry GI Map, in-house Nutra-Avel, GeneSight, neurotransmitter, like anything we need that, we got it. And then they go to checkout, and then we always schedule their first 2 appointments when we schedule their first one. So they'll come back usually 2 weeks later. And then I go, that's an hour appointment, and I'm going over all their labs. And then we kind of start, figuring out like, okay, here's your goals that we got in appointment 1. How are we going to connect our diagnostics with what interventions are going to work? So that might be a recommendation of maybe we add in some hormones. Maybe I recommend a GI map or a gut test or something. Or maybe I say, hey, I know that, you have a strong family history of dementia and Alzheimer's. Do you want to check a longevity panel? And maybe we look at your ApoE, genetic, markers kind of thing. Maybe I add in peptides. Maybe they're here for weight loss. And so I get them on the schedule with one of our nurses to maybe start like a Whole30 diet. And then I'm going to be doing their peptides. So it kind of just depends. That second appointment is why are they here?
I love that you schedule the next 2 visits at the first one. I think that's such a great little business pearl.
Absolutely key.
Yeah, that's amazing. So let's talk about GLP-1s. You're a big fan of peptides. GLP-1 receptor agonists are undoubtedly like the hottest peptides right now. So I have a bunch of questions around this.
Sure.
So first of all, what are the critical pieces that you're looking at in every patient who comes to you for this? And along with that, is it something that you're recommending most of the time to them, or do your patients actually come in and ask, like they come in already knowing that they want to be put on one? I'm curious about that.
Yeah, no, that's a great question. I will say, fortunately for a lot of my nurse practitioners who work here now, is like, I would say, like, I kind of done a lot of the legwork for us, right? So a lot of times patients come in because they were referred by a patient who's already doing all the things. So they come in, they're like, I know that I want my hormones, and I know that I want to get on semaglutide, and I know that I want an in-body. Like they already know. A lot of them have already. So in that first appointment, I always recommend my best patients who get the most benefit out of their experience with us, listen to my podcast, because we literally offer so much that I can't possibly go over all of it with you in one appointment. So we have little QR codes with our podcast. So that first appointment, I'm giving out the podcast card. So when they come back, they'll say like, oh my God, Lexi, I heard your podcast on ozone therapy, and that's what I want to do. So it's kind of like I've put these little pieces in place. I don't want to say on the selling piece, but maybe on the education piece. So patients are empowered. So they know exactly like, Lexi, I need a GI map. Can I get that here today? So they know. So I would say that is absolutely crucial. Now, what's kind of cool is we have patients who maybe don't have any friends, and they're like, I saw this Instagram thing that Lexi was talking about, and that's what I want to do, right? So they've never met me, but what's great is I've already built a little bit of a relationship because they know a little bit about our practice. So if you're a business owner and you're listening to this, the best recommendation I would say is try to build that relationship with the patient before you've even met them. And I think that will help so much in you establishing, a relationship moving forward for that. But I would say some of them come in, but I always tell patients, listen, I'm going to help you lose weight. I promise you that. But we have to look at your hormones. We have to look at your thyroid, because if I just put you on these peptides and you have a crappy thyroid, it's like trying to brush teeth with Oreos in your mouth. Like it's not going to work because your thyroid is crap. So when I explain it like that, like I want you to lose weight and I want you to keep that weight off, but I need to manage these other things, and we can do them at the same time. But this is a must. Like you don't get to get on semaglutide until you've done this stuff. And I tell patients, if that's not what you want to do, I completely understand. Then we're probably not a good fit for each other, and that's okay. That's okay. But I'm going to be really honest with you. I don't take new patients. I take special cases, but I don't take new patients, and I'm not taking new patients. I'm full. And we've been on a wait list for 2 years.
Wow.
So you know what I mean? Like, it's not that, it's kind of like, I want it to be a good fit. Like Absolutely. I want it to be a good fit. It's a relationship, right? It's a relationship. Now it's hard when you are just starting out, but it's kind of like, once you kind of figure out like these are my people, this is who I want to help, I think it becomes easier.
Yeah. So, what are the pieces that you look at for the patient, whether you've determined or maybe they've determined that they want to use one of these medications? So, you
Yeah.
do the in body. I'd love to talk a little
Mhm.
bit more about that. And then, what are the other things that you think are
Yeah.
really critical to look at?
Sure. So on their initial panels, everyone gets an A1C. Okay. And then everyone, I mean, there's a lot of labs that we look at, but I check everyone's liver enzymes. So I want to make sure that, that I'm just keeping an eye on these things, glucose, A1C, all those things. Some other things I like to, and this I think comes from the working in bariatrics, is I like to know their weight loss history. So I'm going to give you an example. Let's say I had this lady and she's weighing 200 pounds. And I say, okay, what's your goal weight? And she says, I want to get down to 110. My next question is, when was the last time you weighed that? Because if it was like just last year, I'm like, oh, okay. If it was when I was 20 and she's now 60, I'm like, okay, ma'am, like we're gonna have to reevaluate our goals here. So that if they've ever had like any kind of eating disorder, if they've had a resective bariatric procedure, and I ask that because I have a patient who has, and I've actually found that semaglutide has helped her body absorb nutrients because it's slowing down that gastric motility, which is great, so great. I ask planning, plans for pregnancy kind of thing. Pregnancies, don't, it's a contraindication. Breastfeeding, personal or family history of thyroid medullary carcinoma. So let me talk about that because I feel like this is a question I get all the time when I speak about semaglutide. Is that a contraindication? So there was one study done in rats using liraglutide that used 10 times the dose and it triggered thyroid medullary carcinoma. There has never been a case to date linking semaglutide at the prescribed recommended doses to thyroid medullary carcinoma. So I think that's really important to distinguish because, papillary carcinoma is the most common type of thyroid cancer, which I have patients who take semaglutide who have had papillary thyroid cancer and they are fine. I ask them, I check their thyroid levels, all those things. So I think that's important to distinguish. Another one, I'll give you kind of another like little weird case. I have an adult female who has cystic fibrosis. And so I checked her pancreatic enzymes prior and they were already like high. And I was like, listen, I don't want to do this. And I told her, if you want to get a clearance from your CF doctor and we can do this, like at least we're like on the same team. But the CF doctor wouldn't clear. And I was like, unfortunately, I can't do that. I do have one, and this is completely off label, but I do have one type 1 diabetic who I have on semaglutide, but it is a collaboration. Her endocrinologist is aware and we are working on it together. So there are some kind of like outliers, but again, I'm making sure that I'm clearing it with whatever specialist is managing that. And they know that we're on the same page. And I can't stress that enough. Like for functional medicine people, I feel like sometimes we're like on our own little island and it's like, it doesn't have to be that way. Now I know that conventional docs will look at us sideways on a lot of the things that we do. But I think if you can show the evidence and really understand the research, I think you have a lot more buy-in from some of those practitioners. So I would say those are probably the contraindications. Some other things to kind of think about would be if they have a history of fatty liver disease, I would actually prefer tirzepatide over semaglutide because there's more studies showing NASH benefits from that. I have patients who we use semaglutide for longevity. And so what does that mean? Is that they don't need to lose any weight, but we want to reduce their risk of amyloid plaque buildup in the brain. So this is another question I get all the time. Well, how many milligrams does that require? And my answer is, I don't know because we don't have a perfect set amount. What I look at is all the contributing factors that lead to progression of Alzheimer's disease, right? So that's looking at ApoB and small dense LDL and ox LDL. So I say, okay, our longevity panel results is what's going to help us understand how many units or how many milligrams is it going to take for us to keep all your risk factors low. And not only that, making sure that their hormones are optimized if they are a candidate for hormones.
Yeah, very interesting. I want to go back to something you said about if somebody's wanting to get pregnant, how far out are you talking? Because we've read about cases, I haven't seen like the literature per se, but I've seen the headlines that, there's increased fertility being on these drugs due to the weight loss, right? Or are there other factors at play?
Yes. So part of it is so I actually presented in Dallas like 2 months ago on this exact topic. It was because what the study showed is specifically in PCOS, you control insulin resistance, you're going to control the androgen production, which can help with improving fertility. And so what I tell them is kind of like, you're going to want to use a backup, like a method of prevention for that. If they're planning to get pregnant, then I usually try to recommend stopping it for like a month prior, just because we don't, I mean, like when you're trying to get pregnant, like, it's like cycles are like, times one. So I will transition them to berberine synergy to help kind of keep that insulin receptor kind of more receptive. But if they're actively trying to get pregnant, and that's honestly, I usually try to screen that out of here before they come to us, because I don't want to have to worry about mom and baby. I just want to worry about the adult. So I usually say about a month prior to that.
Gotcha. And then I'd love to talk more. You and I had a pre-call or a pre-interview call, and we talked about how you cycle GLP-1s. And so I'm really curious about that and some of the dosing. I know it's different for everybody, but I'm curious about that. Yeah. And you also mentioned something interesting is that you don't refill that medication without another in-body scan.
Mm-hmm. Yeah. So in our practice, we are huge sticklers. And honestly, I feel like our patients who really believe in what we stand for, they appreciate it. Like they know the drill. They're like, I'm due for an in-body. I'm due for a refill. Can I come get an in? Like they know, like we've got them very trained and conditioned to know this is the expectation. So to your point, when a patient needs a refill, if they've not had an in-body in the last 3 months, they need to come in. Let's say they had an in-body and they're not losing muscle. Everything is great. Cool. We go ahead and send an in-body. At minimum, we need to see our patients every 4 to 6 months, usually no longer than every 6 months, but a lot of times they're coming in more than that. And then if they've lost muscle, we then have a different conversation of, okay, we need to start adding in some performance peptides to help build their muscle, or, some sort of amino acid. So branched chain amino acids is a great option. Leucine, isoleucine, and valine, building blocks of muscle. So we talk about that. We talk about nutrition, focusing on protein first. So like on their in-body, I know how many pounds of lean body mass they have. And I say, okay, my protein recommendation is I need 1 gram per every pound of lean body mass that you have, not every pound of weight, lean body mass. And then if they're like, oh, that's a struggle, then I say, okay, we either need to 1, lower your semaglutide dose, or 2, we need to get you in with one of our staff nurses to give you a protein list, a meal plan, to give them more support and accountability on the nutrition side. Because I'm not in the business of making people skinny fat. That's not what I do. So there's that piece of it. We also do a lot of other peptides. So it might be a conversation of, hey, come back in and let's go over some of the growth hormone secretagogue peptides that we can add to your semaglutide. We call it stacking. So this way we can help your body kind of increase its ability to make more muscle. So that can be super helpful. When we talk about maintenance dosing of semaglutide, so let's say we have a patient, they got to their ideal weight, they don't want to lose any more weight. Then what I do is I start to titrate them down, and I'll drop their dose by, and I'm going to talk in units because every vial is slightly different depending on where you get it filled. So I might say, okay, let's say you're at 40 units. Let's go down to 35 units for a week and see how you do. Go down to 30 units and see how you do. And then we find like kind of like a sweet spot where it's like, I feel like my hunger is well controlled. I'm maintaining my weight, and I'm not losing any, but I feel pretty good. I have some patients who either want to stay on 10 to 15 units because they find that it just helps kind of curb their appetite, or it just helps them maintain their weight loss. The piece that I always explain is I feel like sometimes when women come in here, they're like, I just feel like if I'm getting on semaglutide, I'm giving up. And I tell them, absolutely not. You're not giving up. The mechanism that's happening in your body during perimenopause, menopause is your body is naturally becoming more insulin resistant. You can be doing exactly the same resistance training, eating the same protein, whole, paleo, whatever. And you're like, I've changed nothing. Unfortunately, your body is changing. And so that little piece of insulin resistance is why so many of these women can't lose weight. They can't lose weight, or they're insulin insensitive. And then the other thing that happens is as women go through menopause and perimenopause is their sleep is crap, right? So then they start drinking the wine to wind down. And now we're in like this vicious cycle because guess what? Their liver is trying to metabolize that alcohol. And guess what? It's not metabolizing estrogen. So then they start to get I'm having hot flashes. I'm getting the midline spread. I'm starting to get hips or, heavy periods, fibroids. It's like a vicious cycle, right? So I'm like, and might I introduce you to a Dutch test? So it's so intertwined. And I know that there are a lot of just weight loss centers and they may be able to treat 80% of the people, but there's a 20% of people, i.e. like our perimenopause, menopause patients who need this extra type of lens from a functional person where it's like you see all the moving parts, right? And I feel like that's where, functional medicine practitioners who do peptides well and who understand how hormones are interrelated can really make such an impact for so many of our patients.
Absolutely. Great insights. And I have some follow-up questions regarding the nutrition aspect. So you're telling them to eat approximately 1 gram per pound of lean body weight. Are you recommending that they track macros also? Like, are you giving carb and fat recommendations as well?
So I am very much try to meet the patient where they're at, right? So if I'm talking to them and I can already see they've got this glazed over look in their eye, I say, listen, just focus on protein.
Mm-hmm.
The chips will fall where they lie, but let's just master protein first. So some patients I say, are you open to tracking? Sometimes the thought of tracking for a patient can be like overwhelming. And that's not the name of the game. The name of the game is to try to help the patient just be better than they were yesterday. And eventually, like we continue to get better. Some of my patients, I'm like, you need this many carbs, this many fat, this many calories. The nice thing is on the in body, it gives us a basal metabolic rate. So I tell them, you cannot drop your calorie content below that. Like that is, you cannot drop below that. I usually try to have them eat around 200 calories above their BMR. So that puts them in a comfortable deficit without starving. So it depends on the patient as far as am I giving them a whole macro plan? If they want one, I will. But a lot of times if I just have them focus on protein, they're not hungry for all the other stuff because they're on semaglutide.
Yeah. And then with the appetite control aspect, some of the things that I've heard from people who are on it is that they're not hungry at all. So it's really hard to eat. Do you see that a lot as well?
I do not in my practice because if they're telling me that, I'm telling them you need to lower the dose. And if you don't lower the dose, you're coming off of it. And so I always say if you can't semaglutide responsibly, you're not going to have it. I've had patients who've left the practice and I tell them it is for the best interest of you. And if you feel like that's not what you want to do, there are literally offices on every corner. Help yourself. And that's probably, like from a business side, like, you're losing a customer. I'm like, but it's for the best interest. And like, I can sleep at night knowing that I'm not contributing to that patient's, lots. We always say muscle is the currency of aging. And so I'm trying to help them be better. So there's that. The other thing is in our practice, I have developed a calculation where I'll take their last their last skeletal muscle mass, and I subtract it from their current skeletal muscle mass, and I divide it from the initial. And if it's greater than a 5% reduction, then they either have to lower the dose, they have to add in a growth hormone secretagogue, and now they have to get another in-body in 6 weeks, showing that they've increased their protein, they've increased their resistance, and they know the drill. Right. They know the drill. My MA, she's like, now think about what you've done. You're gonna have to come back in 6 weeks. Like they know because I've set those expectations with my patients.
What are some of the examples you've mentioned twice? The hormone secretagogue peptides. Which ones are those?
Yeah, so those would be like Semorelin, CJC 1295 plus Ipamorelin, and then my favorite is Tesamorelin. So those are all different growth hormone secretagogues. Some are more like Tesamorelin is the most potent one. Semorelin is probably the least potent one. These are injectable peptides. I know that Semorelin comes in the oral form, which is not. So because you have to go through first pass, like through the gut, it is not as effective as just doing an injectable peptide. And so what this is doing is it's acting on the pituitary gland to help increase its natural production of growth hormone, while the ipamorelin is it's in there and it's extending the half-life of it and getting it out to the cells. This can help with improving lean body mass. This can help with recovery, repair. Sleep is a big thing that CJC does really, really well. It can help with skin texture. A lot of my guys notice the recovery piece of it, especially in the gym. A lot of my women say, like, I sleep so much better. What I notice about it is they're not losing their muscle, just the body composition, dropping fat and gaining muscle. Like, that's the name of the game, right? So those are great. Tesamorelin was a drug that came to market called Agrifta, which was on the market for HIV, lipodystrophy. And so it targets visceral adipose tissue. It also is great for over 60-year-olds, improving cognitive function. And it can also help reduce triglycerides. So if I have someone on my longevity panel and they're high and they're on Tricor and, they're in their 60s, I'm like, you need tesamorelin. So it just depends. It just depends on like what the avatar of that patient looks like.
Very interesting. And my thinking is when I hear some of these, I'm like, we can achieve some of that with supplements as well. And I do want to get into that. But first, I actually want to talk about how you are managing side effects of GLP-1s from like a holistic perspective. And we did a podcast on GLP-1s with Dr. Letisa Carson, who's an OBGYN. And actually, she doesn't see as many side effects because she's using compounded, but that wasn't on the recording because we talked about it like after we had stopped the recording. I'm like, why do you think that you're not seeing all these things that we hear about in the news? And that's what I consistently hear from other practitioners here in San Diego, a lot of the naturopathic doctors I work with. Do you find that it's the same in your practice?
I agree. So I'm going to give you an example. So commercially available, let's just take Wegovy, for example. It goes 0.25 milligrams times 4 weeks. Then you go up to 0.5 milligrams times 4 weeks. Then it's 1 milligram. So in month 2 to month 3, you literally have doubled the dose. There's no like 0.75 kind of thing. In our practice, we start at 0.125 milligrams and then we go to 0.145. Then we go, so we are making like minutes, like patients are almost frustrated. Like, why my friend who got their Wegovy, I'm like, okay, I'd be curious to see what their in-body is. Oh, wait, their primary doesn't have one. So I don't feel like we see a lot of side effects when it comes to dramatic weight loss and what all that entails, because we do keep such a close watch on our patients. I would say the most common would be like heartburn, GERD, reflux type stuff. So I really like to use like melatonin at night because that will increase the esophageal sphincter tone. I love using like mastic gum, DGL, because they probably got a little H. pylori if they've got the heartburn. So I love using that. DGL chewables I really like to use because it kind of soothes that. Aloe vera can coat the inner lining of the esophagus, so that's super helpful. Magnesium citrate to help with bowels. So sometimes if they're nauseous, I'm like, when was the last time you pooped? And so that's because one of the mechanisms is it slows down your gastric motility. So you stay fuller for a longer period of time. On the flip side of that, you can't poop. So, adding in magnesium citrate can be helpful. There is a certain supplement I love to use. I know I can't say names, but it's got some Ayurvedic herbs in there that can help the osmolality. It rhymes with Roland, but maybe doesn't begin with an R.
No, I'm like, wait, what?
I would say, I was trying not to say the name. ColonRx. I'm just going to say it. ColonRx is a great one. So that's a great one to manage those side effects. So I'm just trying to think like top down.
Yeah.
Other one would be like sometimes we see a little bit of the hair loss and they're like, is it the semaglutides making me lose the hair? And I'm like, here's what I'll tell you. Your body doesn't like change, right? So I don't know necessarily, is it that? Is it the lack of amino acids, right? So do we need to add in some amino acids? Do we need to add in some like collagen, maybe some hair, skin, and nails, support? What's your thyroid doing? So like, this is why I tell them, we got to draw all the labs. So when something goes sideways, I'm able to like, okay, here's where baseline was. I can at least see where the hell's the problem. So I would say those are probably the most common side effects. I'm trying to think. Constipation, heartburn, hair loss. I think it's about it.
Yeah, I feel like that's what I most commonly hear, the heartburn and the constipation. So, and there are so many ways that we can naturally help with that.
Oh, yeah.
Yeah, that's amazing. Where do you see the future of GLP-1s? I know you were telling me that there's some like combo treatments that you are excited
Yeah.
about.
So there is another triple agonist that is in clinical trials right now called Retreatide. Truitide. So it's a GLP-1 GIP glucagon agonist. So that will be coming. And then kind of in the peptide communities that I belong to, supposedly there's like a quadruple agonist. But I've not seen any studies on that. There is also currently another peptide is an amylin analog called cagrilintide. And that has been a great add-on to semaglutide. So you stack the peptides, meaning you're doing both of them. And I've almost felt that I've seen better results with, we call it semacagri, than I have with tirzepatide, which is crazy because tirzepatide and the study showed better weight loss outcomes. And now tirzepatide is a dual agonist. So it hits the GIP and the GLP-1 receptor. But if you pair sema and cagri together, that's a dual agonist, and that you're hitting amylin and GLP-1. So when we've hit like a weight loss plateau, I might add in cagrilintide for that.
Interesting. And do you decide at some point to take your patients off of it? Like when they reach their goal weight, do you keep them at a like microdose, or like how do you handle that? I'm sure it's individual still
Yeah.
to the patient, but can you share more?
Yeah, it's super individual, and their budget. But if so I always say like, I call it maintenance dosing. Microdose, I think was like like kind of like a fad term, but like it's just a smaller dose. So we might call it maintenance dosing. So I asked the patient, I'm like, what's our goal here? Like, is your goal to come off of it? What we tend to find is that it can help with keeping your ApoB levels down and your LDL levels down. And if your goal is longevity, like we want to make sure. Now, can you do it on your own? Absolutely. We just want to make sure we monitor it. So it just depends on the patient.
Yeah. And then what are some of the ways that you might naturally recommend to maintain those results, like with supplements?
Yeah. So there's a couple that I really like to use. I really like berberine. I know I keep kind of going back to like Old Faithful there. Berberine is such a good one to use because it has so many benefits for a lot of different reasons. I think that one can be helpful. Looking at some of the supplements that can help with like metabolic dysfunction. I know that there are some supplements, and I know we can't say the names. I'm trying to think what the ingredients in there, like cinnamon bark is one. Oh gosh,
You can just
mentioned.
say it. It's okay. Sometimes it comes out. You can just say it.
Like I can see it. Hold on, I gotta.
Are you talking about Glucose Supreme Herbal?
Yes.
Yeah. Okay.
Yeah. I'm talking about Glucose Supreme. Yeah. I'm like, I can see it on the shelf. I can't think of the name of it. Yeah. So that can be super helpful. So it's just a conversation with the patient. It's just
Absolutely.
what do we want to do? Yeah. I know there are some great options too. It just depends. It just depends on the patient and kind of what they want.
Absolutely. Well, thank you for sharing all that. That was like so much amazing info about GLP-1s, which I think is also relevant because I'd love to talk about the aesthetics side of it a little bit. And we see that many aesthetic practices are also diving into the GLP-1s, which is interesting because like having had this conversation just now, there are so many different factors to consider. There's so much more to it than just prescribing semaglutide, right?
Totally. Yeah.
Yeah. So with the aesthetic side, is this something that, well, I guess you didn't think a long time ago that that's what you'd be doing. You've only been doing that more recently, right? So talk to me about some of the nutrition aspects that you think are the most important with the aesthetic side. And is it that your patients were already seeing you for other things and then you're like, hey, I now offer aesthetics? Or are they coming to you for aesthetics and then you're like, let's talk about the nutrition stuff?
Yeah. So I started out in functional medicine. I didn't start out in aesthetics. And what happened is when you get women feeling better, looking better, losing weight, they like their husband again. They can sleep through the night. They're like, well, what else can you do? Like you're like this like little magic gnome. And so I had a patient, this was 6 years ago. So adding aesthetics is not new. Like I've been doing aesthetics since I've been in my own practice 6 years. But she was like, can you just learn how to inject and I don't have to go anywhere? It's like a one-stop shop. And, at the time I was not near as busy as what I was now. And I'm like, yeah, I liked procedures. I worked in peds surgery. I was like, I could probably learn that. So what I learned in the aesthetics is it's truly the wild, wild west. There is no like bar, like in functional medicine, like the IFM, like if you've been to the IFM or you've gone through IFM, that there's a standard that you've met, right? That's not how it is in aesthetics, which is extremely frustrating, which is why I did the fellowship through the Academy of Antiaging. So I started offering it to patients. And again, what's so amazing with that is when you get a relationship with a patient, it's really hard to break that bond. And so they were very willing to let me learn on them, practice with them. If I, messed up their eyebrow, I had to see them for thyroid follow-up. So they had to tell me, and I don't do anything lightly. Like I don't ever dip my toe in something. Like if I'm doing it, I'm going in. So that's kind of where that came from. And so my patients, they very much focus on the natural aesthetics, right? So they don't want to look overfilled. We always say we want the undetectable injectable. And it's like, you look better, but I can't tell what's better about your face. So we focus a lot on stimulating collagen is probably one of the biggest things. So we use a lot of PRP, which is platelet-rich plasma. We use a lot of biostimulators. On the aesthetic side, we have an amazing aesthetic nurse. Her name is Carmen, and she will do like a skin consult. And so if she sees like a woman coming in here, and I know if you're listening, in your car and you can't see me, I'm pointing to my jawline. If she sees, this gal's got some hormonal acne, she will probably recommend, like, you probably need to go see one of our functional medicine people so they could maybe look at your hormones. Or if they're coming in for a hair restoration, she may say, ooh, you probably need to go see one of our providers. If they come in for acne, like on the forehead or the cheeks, she might say, have you had your gut test done? And so she might recommend it. So what's great, because she's a patient, and so she's been through a lot of it. Rosacea, that's another thing. So, on the aesthetic side, we may treat it with topicals and lasers. I'm over here like, what kind of fungus you got growing in your gut?
Yeah.
So it very much marries well. You just kind of have to know what you're looking for. And if you're an aesthetics practice listening to this podcast, because I know that we have some in our academy, is you want to train up your estheticians and your aesthetic nurses to just start. They don't have to have a functional medicine degree, but just start thinking about, okay, if it's on the face, it's very likely going in on the gut or somewhere in the hormones. So that can be helpful. One of the things that we use a lot in our practice is there is a supplement that is made by a wonderful company, and it's got a blend of some different herbs that help with hormone detox. There is one that just came out. It was we used it as, I'm just gonna say it was FemGuard, but now I believe it's Balancer Out. Why I like that one is it's got a little mix of some of the herbs like dim and calcium diglucarate and chrysin, which can help with some of the estrogen detox type symptoms. And it's also got some good B vitamins. Now I'm going to just say one thing. You got to be really careful with acne and B vitamins, because when people are overdoing it on B vitamins, it can cause acne. So just keeping that in mind. So I think that there's a huge opportunity for functional practices to start looking at that if that's their interest, and aesthetic practices to add in. We call it functional medicine. They call it wellness. But here's what I will say from a business perspective. You have to love it. And if you don't love it and you're just doing it so you don't lose your patients, you can tell. And I'm saying that from experience in seeing, we have patients who come from other practices and they're like, well, I came here because it seems like you guys do more of it. And the other thing is, and I hate to say it, Evelyn, you got to look the part. Like, you got to believe in what you're doing, right? So if you're recommending weight loss, I'm going to tell you, like, you better look the part. You better look like you work out. You better look like you care about, certain things. So I think there's a great opportunity to marry both worlds, but I think you have to have the right kind of mindset to do that, and the right team. I would kind of circle back to what I started with. You got to have the right team.
Absolutely. Absolutely. Thank you for sharing that. Just really quick, are there, what would you say are your top nutrients for healthy hair, skin, and nails?
Collagen, omega-3, probably selenium, because selenium is such a key part for the thyroid that I'm like, it's probably the thyroid. Just blame the thyroid. That's what I do. Selenium, omegas, and probably collagen.
Nice. Love that. Well, I'd love to wrap it up with some rapid fire questions. And actually, the first question that I ask everyone is, what are your top 3 favorite supplements for yourself?
Saccharomyces boulardii, yep, collagen, and berberine.
Awesome. And what are your favorite health practices that keep you healthy and resilient? And you're a business owner, a mom, doing a lot.
Yeah. Prioritizing sleep. So like that's a non-negotiable. And I started using something called Brain Tap, which uses binaural beats. And it has like these like lights that you put over your eyes. And I track my sleep with my Oura Ring and like super nerd out about sleep. So priority number one is sleep, because I feel like if you don't recover and restore well, that's when your growth hormone's being made. That's when your liver does all its work. The rest of the day is crap. So sleep is number one. Movement, resist in the form of resistance training. Like I can't stress that enough, in that I weight lift 4 or 5 days a week. It's super important to me. My kids weight lift. I think that is also a non-negotiable. And then I think the third one is kind of like the people who you surround yourself with, I think play a huge role in it, right? So, surrounding yourself with people who want to see you do well and who encourage you and who also can kind of keep you in check when you need to be, I think is important. So having a good network of support, because I always say this, like people say, I don't know how you do it all. And I tell them, I don't do it all. I have a lot of help. You just don't see them on Instagram, but I have a ton of help. So I think as women, we're so hard on ourselves. And I think being very honest. And I tell people that I'm like, I got my mom lives 10 minutes away. My husband works here with me. Like I have a ton of help. So I think who you surround yourself and building a system around you that allows you to be your best self, I think is key.
I love that. What is something that you've changed your mind about through your years in this field?
This is a good one. So, I think so many times, like in functional medicine, I love testing. I love testing, especially because you go through the IFM and you're like, I learned how to do this. And I know how to. I think sometimes, like when it looks like a duck and it walks like a duck, do I need that $400 test to confirm what I already know through clinical experience? Maybe not. Maybe we try the interventions, and if it doesn't work, then we can go back and do the test. So I think financially that can save patients some, time and money, which I think is huge. And so again, I love integrative testing, but I think sometimes we as functional medicine people can overdo it with that and supplements. So I think that the older I get into my functional medicine career, I'm like, I don't really know if I need that.
Yeah. And it's true, when you gain so much experience, it's like you know what to do and what will work. And then if it doesn't work, then you can do the test.
Right.
Yeah.
Sure.
And Lexi, you get a bonus question. Tying it back to where we started with business, I'm curious, what is your vision for the next 5 years and beyond that?
At some point, I would love to whittle down kind of my patient list to, I would call them like peak performers of longevity, right? So people who nerd out like me, who like want to wear an Oura Ring like me and who want to brain tap like me. And I feel very fulfilled. And not only that, I learn so much from those patients that it helps me become a better educator. So I would like to kind of maybe cut back my hours to really focus more on the research part of it, so to speak. The other thing is I love the business building side of it. And so taking the academy that I have and maybe picking 1 or 2 practitioners and really helping them build their business. It's going to be a while before I can really, I think, focus on doing that, because I've got 5 nurse practitioners with a 6th one on the way and just training them up. And it takes time. And you can't rush it, because then when things get missed, the only one you have to blame is yourself. So 5-10 years, something like that. Research, longevity, building up other practitioners.
Thank you, Lexi. That is awesome. And you're such a go-getter and so inspiring. I love it. Where can practitioners learn more about you?
Yeah, so I do quite a bit on social media. So my handle is at Lexi, spelled LexiYoonp. So like nurse practitioner. I have a podcast called The Better You Project, and it's you spelled YO, so The Better You Project. I'm on YouTube as YDH Academy. Our training academy is www.ydhacademy.com. So I think those are all like the major places you'll find me.
Great. Well, thank you so much. This has been a really, really fun conversation. I really appreciate it.
Yeah, absolutely. Thank you.
Thank you. And thank you for tuning in to Conversations for Health today. Check out the show notes for resources from this episode. Please share this podcast with your colleagues. Follow, rate, or leave a review wherever you listen or watch. And thank you for designing a well world with us.
This is Conversations for Health with Evelyn Lambrecht, dedicated to engaging discussions with industry experts, exploring evidence-based, cutting-edge research, and practical tips.